Now, when it comes to MDMA and PTSD, the thought behind the use of MDMA and PTSD is that it can help diminish the individual's fear response and allows them to let down their guard and observe and work through their trauma for more of a detached, objective perspective. All right, MDMA and PTSD. A lot of people have PTSD. It's not just you go to war and you come back home and you're starting to have nightmares and you can't really function day to day. It doesn't work that way. It's not just PTSD on the most dramatic level or the classic level that we think of. All of us are carrying some level of post-traumatic stress disorder. Oftentimes we encounter a trauma, and the trauma is the trauma, but the way we live our life after the trauma, what has changed with our being, how our emotions have shifted, what have we repressed, what have we expressed, that's the PTSD. It is the trauma that shakes our lives into the way that we present every single day. So many of us are living with PTSD and we don't even know it. So I want to talk a little bit about something that's coming down the pipeline that is really, really, really powerful, and that's MDMA. So you might have heard of Molly. That is a club drug, the street drug, but we're talking about purified. When you're talking about the street stuff that you get from the guy in the back of the club, we're talking about the purified stuff that you do in a clinical context with a trained professional. MDMA, it was developed actually in 1912, not in your lifetime, even though it gained a lot of popularity maybe in your lifetime, but it was developed in 1912 by a German pharmaceutical company. And the main purpose of MDMA was actually to control bleeding. And throughout the 70s and 80s, psychiatrists started to report seeing an enhanced level of communication with their patients after they used MDMA. So one of the psychiatrist's quotes were, they allowed patients to achieve insights about their problems. And no clinical trials or FDA involvement was set up to this point. So what we were seeing is, okay, we're going to use this drug to treat bleeding, but instead, psychiatrists were finding better connection with people who take MDMA. So in 1985, the DEA declared MDMA a Schedule I drug. Now to understand, Schedule I is defined by the following characteristics: high potential for abuse, no currently accepted medical treatment use in the United States, lack of accepted safety for use under medical supervision. Some other Schedule I agents: heroin, LSD, THC, peyote, MDMA, psilocybin, and bath salts. So in 1990, FDA approved the first human trial with MDMA. And this research was exploring pain relief with MDMA in terminally ill patients. And it was administered alongside psychotherapy, and the results were not published. But in 2002, there was publication of MDMA as a treatment for PTSD. And this was funded by the MAPS organization, Multidisciplinary Association for Psychedelic Studies. They've been out for quite a while now, but they're really the ones leading the charge on what the role of psychedelic or psychedelic-like agents are doing in physical and mental health. So a lot of you wonder, how does this even work? Well, it's a monoamine releaser. That is serotonin, dopamine, noradrenaline, and oxytocin. That's the reason you feel so good when you take MDMA. Brain imaging has shown reduced amygdala activity with MDMA. That is the overall hypervigilance, anxiety, and that's decreasing, right? The part of your brain that is emotionally connected to survival, and it's increasing relaxation. In the context of PTSD, people who have suffered with this tend to avoid trauma-related thoughts, emotions, discussions of the event. But these things will surface one way or another. And we know that with emotions, right? When emotion is repressed, it will surface one way or another in your life. You'll attract the people, the places, the things, situations, circumstances to really align with that trauma or this repressed emotion so you can feel it again. Now, the pathology, though, what happens in the brain or in the body with PTSD is not very well understood. And researchers hesitate to use treatment for PTSD, especially when they're talking about MDMA. Many people with PTSD struggle to identify that there even is fear, or what it is, or what emotions come with it. Now, when it comes to MDMA and PTSD, the thought behind the use of MDMA and PTSD is that it can help diminish the individual's fear response and allows them to let down their guard and observe and work through their trauma for more of a detached, objective perspective. Now, these individuals are staying emotionally engaged with traumatic memories, but they're not being overwhelmed by the anxiety or the painful emotions or avoiding them, or dissociating, or even emotionally numbing. So what do we see in the research? PTSD. The first controlled clinical study demonstrated this. MDMA-assisted psychotherapy was eventually published in 2010, and it had impressive results. And this is what we saw. 20 patients with treatment-resistant PTSD received, during a course of non-drug psychotherapy, either an active placebo or 2 or 3 sessions with MDMA. The initial dose was 125 milligrams, followed 2 hours later by a further booster of 62.5 milligrams. At the 2 and 12-month follow-up, 83% of the experimental group no longer met criteria for PTSD, compared with just 25% of the patients in the placebo group. So there were no drug-related serious adverse events or no adverse neurocognitive effects. And long-term follow-up of the cohort of successfully treated patients demonstrated that remission from PTSD remained up to 6 years without having any further doses of MDMA. That's incredible. That's incredible. If you can bottle that up for PTSD and sell it as a drug, that would be one of the most incredible drugs for PTSD that you can possibly take. And that's coming in the pipeline right now. What impressive results we saw with MDMA and PTSD. To think someone could take such a low dose of MDMA through these sessions and for 6 years be clinically PTSD free and not have to take MDMA again. My theory is that the MDMA allowed people to face the emotions within them that are scary. And by doing so, the body is able to process it. Really, PTSD just is emotional suppression of the trauma, coming out as anger, repressed memories, dreams, aversion to sounds, phobias. It's just a repression of that emotion. Whether it's anger, whether it's helplessness, whether it's shame, whether it's guilt, whatever PTSD is for you or for the person who is looking or seeking for the treatment, what I believe MDMA is doing is just allowing people to be brave enough to come into the body and re-experience those emotions. So it stands to believe 6 years, 10 years, 12 years, 100 years later, it's going to be healed. In 2018, we also saw, for a team based in Boulder, Colorado, they submitted their results of a dose-response model from multiple therapy teams on 28 participants. They had 2 active doses, 100 and 125 milligrams, and they were compared to the low-dose 40 milligram session. And later, the 2 low-dose groups crossed over for 3 open-label active dose sessions. Now, that's just one study among many other studies that we're seeing being published over and over. And there's large institutions throughout the United States that are getting behind this and really looking to see what they're finding in these studies and how clinically significant, how safe, how effective is the results that we're seeing. And a lot of these institutions across the United States are seeing very impressive results. Okay, so say you're listening to this and you have PTSD and you want to seek out your own treatment with MDMA. Get in touch with the MAPS program that I just mentioned before. Call them up, email them, find them on Instagram, however you do it. And tell them that you're suffering with PTSD and you want to find out if you can be enrolled in a study that's local to you. And you might find that it's easier than you may think. So very important to understand that you get all of the informed consent, find out what the possible side effects are, find out how it can affect you. And I'm sure that they do a full history of your physical, mental, emotional, family, everything. But to keep yourself safe, have the conversation with the people at MAPS, and also make sure you talk to your doctor. Make sure you talk to your doctor and find out if it's safe for you and express your interest, because when it comes to PTSD, allopathic medicine ain't got no idea what to do with it. So very important is to understand that there are some treatments out there giving such impressive results. So get in touch with them if you're suffering with PTSD. Also, if you're suffering with PTSD, get in touch with me. I do emotional release. We can work through it. Very powerful stuff. Shout out to my medical researcher, Michael Knox at Michigan State University. He is in medical school, medical resident, and he is my go-to guy when it comes to so much of this research. So he put together so much of this. So thank you, Michael.